we had seen about osteology of head and neck. In that, I had mentioned in next class we will be seeing the structures passing through the foramen. So I have first mentioned about few important foramens, then all the other foramens I'll be talking about. So first, greater palatine foramen. So what does it transmits? The greater palatine vessels, the anterior palatine nerve, the lesser palatine foramen transmits middle palatine nerve, posterior palatine nerve. What does foramen ovale transmits? So the mnemonic is male, the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissory vein. And foramen magnum. So foramen magnum is important question. It might be asked for 5 marks or 2 marks. Even other questions are 2 markers. All these might be asked for 2 marks. So foramen magnum. So through narrow anterior part, it transmits apical ligament of dens, vertical band of cruciate ligament, membrana tectoria. Through wider posterior part, it transmits lowest part of medulla oblongata, 3 meninges. Through subarachnoid space, it transmits spinal accessory nerve, vertebral arteries, sympathetic plexus around the vertebral arteries, posterior spinal arteries, anterior spinal arteries. Okay. So this diagram is important. You can draw this diagram while explaining the answer of foramen magnum. Okay. Then jugular foramen. Through the anterior part, inferior petrosal sinus, meningeal branch of the ascending pharyngeal artery. Through the middle part, 9th, 10th and 11th cranial nerves. Through the posterior part, internal jugular vein, meningeal branch of the occipital artery. So we can just go through all the foramens and the structures passing through them. Okay. So anterior cranial fossa, groove for superior sagittal sinus. So anterior cranial fossa. So here at the anterior cranial fossa, middle cranial fossa, posterior cranial fossa, then other foramens. Okay. So through anterior cranial fossa, through superior sagittal sinus, through foramen cecum, emissory vein to superior sagittal sinus from upper part of nose, anterior ethmoidal foramen, then foramen of cibriform plate, olfactory nerve rootlets, posterior ethmoidal foramen, posterior ethmoidal vessels, then middle cranial fossa, optic canal, optic nerve and ophthalmic artery, superior orbital fissure, lateral part, lacrimal and frontal nerves, branches of ophthalmic nerve, trochlear nerve, superior ophthalmic vein, meningeal branch of lacrimal artery, anastomotic branch of middle meningeal artery, which anastomoses with recurrent branch of lacrimal artery. So all these foramens has the diagrams. I'll show you in the next slides. Then in the cranial fossa through middle part, all these we should know for actually MCQ questions. In general questions like for BDS examinations, they have asked like very less, like 2 markers and 5 markers they have asked from this osteology chapter, and they have not asked in depth. Okay. For MCQ they had been asking all these foramens. For competitive exams, you should know all the things, like every detail you should be knowing. Otherwise, for examination, BDS written theory examination, you should know few important things. You should go through the question papers. When I will discuss few questions, few important questions. Okay, in the coming next videos I will be discussing 10 markers and 5 markers. Then next, posterior cranial fossa, we have foramen magnum and jugular foramen we have seen just now. Then hypoglossal canal, internal acoustic meatus, external opening of vestibular aqueduct, posterior condylar canal, mastoid foramen. Okay. Then through other foramens, These other foramina, I think even in MCQs they haven't asked this, but I have marked few with pen, like retropalatine foramen, inferior orbital fissure, mandibular foramen. These might have asked, they might have asked, so only I had marked with pen. Mastoid canaliculus, auricular branch of vagus nerve. So we will see the diagrams of all these foramens, and then I'll be discussing few MCQs on osteology in the next video. So this is the diagram showing the relationship of foramen lacerum. So foramen lacerum, meningeal branch of ascending pharyngeal artery, a measury vein from cavernous sinus, internal carotid artery, greater petrosal nerve. All these things are important structures through the foramen lacerum, and this diagram is also important. It might be asked for 2 markers, but for MCQ questions, competitive exams, it's very important. And this is the mandibular nerve, that male which we have seen passing through the foramen ovale. Okay, in that we had seen mandibular nerve. Then this is the diagram of the mandibular nerve and its distribution. Then this is the anterior clinoid fossa process, anterior fossa. So in that we can see this foramen cecum, then cribriform plate, and anterior ethmoidal canal, crista galli. Okay, we had seen this. And then this is middle cranial fossa. In that you can see that foramen ovale over there. Okay, and the structures passing through that, and other important foramens which has been mentioned over there is foramen spinosum. We had seen that foramen spinosum, and that the structures passing were meningeal artery, middle meningeal artery, meningeal branch of mandibular nerve or nervus spinosus, and posterior trunk of middle meningeal vein. These were the structures passing through the foramen spinosum. And you can see other foramens over there, and these will be also asked in the MCQs, which is the foramen which is located laterally, which are the foramens located medially. Okay, that also we should be knowing. So in the next class we'll see about important questions, MCQ questions, and also important 5 and 2 markers on osteology chapter. And also we will be seeing other structures like mandible and axis, atlas and all in the next video. Till then, thank you, take care.